This is a special edition of Nightline, Pandemic, A Nation Divided.
Transit runs 24/7, 7 days a week. You can't stay home. Buses don't drive themselves.
First light has yet to break. But at this bus depot in the South Bronx, Wayne Lizardi has already been behind the wheel for hours, shouldering a heavier workload since the outbreak of the coronavirus.
There's extra buses that are running to compensate for the 4 hours that the subways aren't running. So I picked up a trick from 2 to 5.
His bread and butter, shuttling essential workers across New York City at all hours. Now a COVID front line.
We are putting our lives out there. If you were to tell me that we were going to have a pandemic in 2020 and that you're going to be out there and you could very possibly die, would I have signed up for it? I don't think anybody would sign up for that. But we did, and we're here and we're working. You got to do what you need to do.
Welcome to the Bronx.
This is a community full of richness and history. We are deliciously loud here. We are extremely festive.
The northernmost of 5 New York City boroughs, separated from Manhattan by bridges and tunnels. Home to Yankee Stadium, the Bronx Zoo, and nearly 1.5 million New Yorkers, many of them essential workers.
Before COVID-19, the Bronx was known as the poorest borough. It's come to be known as the essential borough.
Workers who didn't have a choice to shelter in place, often people of color earning low wages. And now, this grim reality. The Bronx is home to the highest rates of COVID-19 deaths and hospitalizations in all of New York City. It's the epicenter of the epicenter. The Bronx is the poorest borough with a historically disenfranchised Latino and Black majority. Residents here more than twice as likely to die from COVID than anywhere else in the city.
Poverty is poison. Hardly an accident that the Bronx has become the epicenter.
The deadly pathogen exposing the stark divides of race and class, the haves and the have-nots.
Hey, baby girl, can you dig? Yeah. Sure, you can dig. Go inside.
In the Southeast Bronx, community organizer Tanya Fields has cultivated an urban farm where she, along with her 6 children and neighbors, grow everything from herbs to fruit trees.
Here is a Macoun apple tree.
Even raising chickens.
Just think clockwise, counterclockwise. Clockwise is on, counterclockwise is off. A little bit of...
Tanya is preparing to distribute fresh produce to her neighbors, weeks after recovering from COVID-19.
Thomas, ball inside, please. I got very, very sick for about 3 weeks. Unproductive cough, fever of about 101, body aches and chills.
Within days, the virus stormed through the 3-bedroom apartment shared by her family.
How hard is it to socially distance in an apartment with 6 children?
It is impossible. I was wearing a mask in my house almost 24/7. I tried to stay out of common areas like the kitchen, but that's difficult. My eldest daughter, who is 17, college bound, she got the sickest of all of my children. My 16-year-old, who was chronically asthmatic, she was having a lot of wheezing and a lot of problems breathing.
You refer to yourself as a cash-poor Black woman, and yet you're spending your money on these fruits and on these vegetables.
Yeah.
Why?
As someone who raised, my older children on welfare, by being in community with other folks who have paved the way, I have been able to gain some things that some of my neighbors have not. I'm a college graduate, and I fought tooth and nail to raise 2 children and claw my way to graduate. So while I don't make even $30,000 a year, I am able to provide this to my community.
Are you worried that people in your neighborhood are going to go hungry during COVID?
People in my neighborhood have already been going hungry.
The South Bronx is ground zero for racially concentrated poverty.
Even before the pandemic, hunger was no stranger here. 1 in 6 residents experiencing food insecurity in 2018.
We have enough, though. Okay. Much of my job is to ensure that they have access to food. I've never seen just a more overwhelming sense of desperation in my district.
A city divided is an adage that's long held true for City Councilman Richie Torres.
Take care. God bless you. God bless you. We want to provide people with a warm meal, groceries, a mask, and water.
He too recently recovered from COVID-19. Since then, FaceTime with constituents has meant seeing a little less face.
I can't recognize anyone with a mask.
The youngest ever elected to New York City Council at 25, now 32, and running to represent the poorest congressional district in the country, vowing to improve public housing.
I felt that public housing had become the forgotten city. I could advocate from a place of lived experience. So I grew up here at 2751 Sampson Avenue, apartment 2A. So my maternal family has been living here for 3 generations. My grandmother moved in the 1950s. She was one of the first Puerto Rican families here.
Is that?
Hey, Ma.
Hey.
Love you, Ma. Love you more. My mother's 60. She has hypertension, so you have to maintain distance from your own loved ones for their own protection.
Her hypertension, one of the many invisible ties binding poverty to poor health. This borough, home to power plants, waste treatment facilities, and tucked between highways that for decades gave rise to unforgiving health consequences. Children here twice as likely to be hospitalized for asthma than their counterparts just across the river.
You were also diagnosed with asthma at the age of 8.
Yes, so when you live in conditions of mold and mildew and vermin, all of those are known triggers for asthma. And so I was repeatedly hospitalized as a child.
Poverty takes a toll on the body.
The difference in life expectancy between the South Bronx and the Upper East Side of Manhattan is 10 years. So poverty's poison.
Hay mucha comida ahí, mi hermano.
Sí. For 2 decades, Dr. Ramon Talaash has been seeing patients from New York City's immigrant communities.
Put your mask on.
His team, one of the few lifelines to predominantly Spanish-speaking patients. When the testing was slow to come, they took action. Now partnering with the state to add 28 additional sites.
From the beginning, we've been trying to get testing in our community, but we did it ourselves. We put on the line a lot of money, the doctors, to do ourselves, and we want to continue doing it for our own people.
Dr. Talaash says his patients are more likely to be uninsured than the national average, and they can no longer be ignored.
Once you know what's going on for the people who are in the front line, like us, and you didn't pay attention to us, then that's different. That's negligent.
Many in this community, often the last to be helped, have been the first to be called to work. Lizardi is a second-generation bus operator, driving the same streets his father, who immigrated from Puerto Rico, once did.
He drove for 23 years. I would ride the buses with him, just kind of people watch. And it was very interesting, as a kid.
But the onset of the outbreak transformed his outlook.
We were very, very scared. There's no line of defense out there. We're on a bus with 10, 15, 20, 60 people. I felt like I was a sitting duck.
Lizardi says many of his colleagues called out sick, and soon he received word that one of the drivers from his very depot passed away from COVID-19.
Shocking, shocking. You see people every day, and then all of a sudden somebody's not there for a day, 2 days, a week goes by, and then we got word that he was sick and he was out, and he ended up passing.
Veteran driver Leon McKnight was 49 years old, a father of 5 who loved to talk about his children. He's one of more than 120 New York City transit workers who have lost their lives to the coronavirus. Protections for New York City bus drivers have improved.
There were barriers put up. They did start providing us with masks. The buses that are coming in being sanitized every night.
But fears of contracting the virus are never too far.
Am I still nervous now? We all are. We have a lot of people that we move, and there's some people that come on with no mask, they're coughing, and it's only getting worse out there. More and more people are out riding these buses.
And yet determined to do his part for the city that never sleeps.
I'm going to keep working until, God forbid, something happens.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.